Hello everyone, and thank you for joining me. Today I'm going to be presenting a paper on translational research with respect to ABA and mental health. What is translational research? Translational research in behavior analysis seeks to bridge the gap between the branch of behavior analysis which focuses primarily on the experimental analysis of behavior, or EAB, and the branch of behavior analysis which research focus is primarily applied, or ABA. Translational research, as the term implies, translates basic knowledge of the principles and theories of behavior into clinical and practical applications. As Lerman and Mason-Critchfield simply stated, translational research translates research into practice and integrates pure basic science with pure applied work. Translational research in behavior analysis is a much-needed area of research in that A, it promotes a reciprocal relation between the two branches of behavior analysis, and B, it has significant implications in the use of experimentally tested, evidence-based behavioral analytic approaches to address socially significant behaviors. Now let's discuss some areas in behavior analysis where translational research is lacking or scarce. Although translational research in behavior analysis is growing, certain areas within behavior analysis show paucity in translational research, specifically in behavior analytic journals such as JABA. One particular area where further translational research is needed is clinical behavior analysis. Clinical behavior analysis is a relatively new subfield of behavior analysis that, as Dulfer and Hayes in 2000 defined, applies the principles of behavior analysis to problems, settings, and issues typically confronted by clinical psychologists working in outpatient settings. Some of those issues that are typically approached by psychologists include addiction, substance abuse, and mental health. With respect to ABA and mental health specifically, translational work in that area is scarce. As a matter of fact, a search in JABA reveals very few studies on mental health issues such as substance abuse, even though this problem is of huge social significance. Furthermore, behavior analytic literature on the treatment of substance abuse is not found in JABA or JAB, but rather in medical, psychiatric, or drug abuse journals. Yet many of the interventions designed to treat these disorders are behavior analytic in nature. Translational work in this area is needed for the development of effective clinical interventions designed to treat the challenging and complex behaviors emitted by the mentally ill population, such as schizophrenics, substance abusers, etc. The purpose of the present paper is to argue for more translational research in the area of ABA and mental health, provide a brief review of some of the past and current literature on ABA and mental health, and to propose areas in which research on ABA and mental health can be extended. Let's look at some of the past and current literature on the applications of ABA principles and technologies to mental health issues and clinical disorders. Although limited compared to that in psychological journals, the literature on mental health and ABA and behavior analytic journals, such as JABA and JAB, does reveal some interesting reviews and applications of basic behavior principles to the treatment of behavior disorders emitted by individuals with mental illnesses. For instance, in their 1965 JAB published study, Elon and Azrin evaluated the effectiveness of reinforcement-based procedures on the adaptive behaviors and performance of psychotic patients on a mental ward. The study, comprising of 6 experiments, demonstrated the effectiveness of a reinforcement procedure in maintaining adaptive behaviors of mental ward patients with different types of psychoses. The study presented significant implications in the clinical applications of ABA with the mentally ill population, specifically with the use of conditioned reinforcers like tokens. In their study on the assessment and treatment of bizarre vocalizations of an adult with schizophrenia, Wilder et al. In 2001 conducted a functional analysis to identify the variables maintaining bizarre vocalizations which they considered to be operant behavior and therefore susceptible to environmental manipulation. The function was identified as attention maintained, and subsequently an intervention consisting of differential reinforcement of appropriate vocalizations was implemented and proved to be effective in significantly reducing bizarre vocalizations. The study's findings had considerable implications for the use of a behavior analytic approach to the treatment of mental health disorders by effectively demonstrating that many of the behaviors emitted by individuals with mental health disorders, such as schizophrenia, can be viewed as operant behavior influenced and maintained by environmental contingencies. In their literature review article, Miltenberger et al. In 1998 sought to bring attention to the application of behavior analysis to clinical problems by providing a review and analysis of habit reversal, a robust treatment package that is typically used to treat tic disorders such as motor tics, vocal tics, tics associated with Tourette's, etc., nervous habits such as nail biting, hair pulling, mouth biting, teeth grinding, and stuttering. Miltenberger et al. Discuss habit reversal and the behaviors typically treated using this treatment package. They discuss its limitations and appeals for future research, specifically with respect to further evaluation of each component of the habit reversal treatment package and further analysis of the variable maintaining habits. The article had considerable implications for the application of behavior analysis to behaviors of social significance, yet not necessarily associated with developmental disabilities. In addition, the article stimulated future research on functional assessments and functional analyses of behavior which are typically not exhibited publicly. In a special issue in JABA on the analysis and treatment of addiction, Silverman et al. In 2008 provided an overview of current ABA research in the area of drug addiction with a focus on contingency management interventions in the treatment of drug addiction. The authors argued for the need for more research to further improve the effectiveness of contingency management interventions across larger populations and to develop methods that will promote and ensure long-term abstinence from drug use. In addition, various applications and types of contingency management interventions along with their effectiveness were discussed. The article had significant implications for the future of behavior analysis and its applications in the area of substance use disorders. As I've previously mentioned, translational research in the area of clinical behavior analysis is very limited and appears to be favored most by non-behavior analytical journals. Behavior analytic literature on ABA and mental health or DSM disorders in JABA is scarce, and even more scarce is translational research in that area. Many of the disorders identified in the DSM-5, such as OCD or Tourette's, include behavioral characteristics. Yet, the treatment of choice for those disorders most often involve a cognitive approach more so than a behavioral approach. One possible explanation for the lack of behavioral analytic content in treatment approaches for such disorders may be the lack of collaboration between mental health professionals and behavior analysts. Mental health disorders have historically always been tackled by psychologists and psychiatrists solely, while in contrast, behavior disorders typically exhibited by the developmentally delayed and autistic population have been tackled by applied behavior analysts. As such, there's always been a sense of segregation between mental health and behavior analysis. Another possible explanation for why behavior analytic principles are not applied to DSM disorders with behavioral characteristics may be the lack or scarce amount of research in the area of ABA and mental health, which again can also be attributed to the just mentioned separation between the two fields. So to conclude, it is evident that there is a need for more clinical behavior analysis translational research, specifically on the application of ABA principles to the assessment and treatment of mental illnesses and DSM disorders. As Wilder et al. In 2001 and Elon and Azure in 1965 effectively demonstrated in their respective studies, those behaviors that are typically emitted by individuals with mental illnesses are to be viewed as operant behavior that is influenced by environmental contingencies and therefore is sensitive to environmental manipulation. As such, an expansion of ABA to the field of mental health would not only meet the research needs of both fields, but such an expansion would fulfill JABA's initial mandate to address topics and problems of social significance. And mental illness absolutely is of social significance. The purpose of the present paper was first to argue for more behavior analytic research in the area of ABA and mental health, and secondly, suggest areas in which research in ABA and mental health can be expanded. One area in which research can be further extended is the assessment and treatment of DSM-5 disorders using an alternating treatment design to evaluate and compare the effectiveness of ABA-based interventions versus non-ABA-based interventions such as cognitive behavior therapy or medication. Although there are studies evaluating the effectiveness of each approach individually, few studies, if any at least in JABA, have used a comparative design to demonstrate the effectiveness of one over the other. Another area of research is evaluating the effectiveness of behavior analytic technologies such as differential reinforcement in the treatment of problem behaviors emitted by individuals with psychoses using a multiple baseline design. I'd like to end this presentation by reiterating the importance of sustaining the field of behavior analysis with research, basic, applied, and translational, but also expanding the field into newer areas. I think most, if not all, behavior analysts will agree that it is time for behavior analysis to be known as the science of behavior, the science of all behavior. What better way to do that than to conduct and provide the public with research and knowledge on ABA and its applications with such a great socially significant issue as mental health. Thank you all.